Hey guys, Dr. John Schaefer here. Today we're going to be talking all about knee osteoarthritis, also known as knee OA. This is one of the most common conditions that I deal with, something that I constantly hear people come to me with complaints regarding. They'll tell me things like they're bone on bone, their knees are just killing them, it's old age. All these things are kind of referring to the same knee pain that tends to occur as people age, and that is due to knee osteoarthritis. So I'm going to bring my little knee model today and we'll talk through different causes, how you can know if this is something you're dealing with. It just gets you feeling more comfortable about what's going on because there's nothing worse than having pain but not understanding what it's from, why you're having it, all that good stuff. Because if you're left confused, then you're likely going to go down a medical route in which you're going to have x-rays, you're going to have surgery, and it might not be something you want. So, knee OA is a degenerative joint condition where the cartilage or the smooth cushioning tissue at the ends of your bones, you can kind of see here, the cartilage is what fills in the gaps between. And that can start to rub against each other, and that causes pain, stiffness, swelling. And really, that's what leads to changes in how your knee moves. So if you see people start to walk with a limp, or you see knees that are either caving in or bowing out, sometimes that can be due to knee osteoarthritis. Usually, only if it's fairly severe or progressive will you start to notice that. But think of your knees as like a well-oiled machine. And when that oil starts to dry up, or in this case, the cartilage breaking down, things can start to grind and then wear and tear can accelerate a little bit. But this isn't meant to be something where, oh my gosh, this is really scary that it happens because it happens to everyone. Just some people experience pain when this happens and others don't. And the reasoning why we don't necessarily fully always understand. So let's start to talk about why knee osteoarthritis happens in the first place. So, knee OA isn't just about getting older, although age can be a factor. So, we'll go over some of the main causes here. The first is age or wear and tear. So, over time, our joints do take on a lot of stress. Throughout your life, you're doing all kinds of fun activities, whether that's sports, doing all kinds of adventuring, maybe it's a very physical job, whatever it is. All that can wear on your joints. I had someone describe to me as your joints as like tires. You really only get so many miles. Again, I don't want to use terminology where this is all finite. Your joints are going to wear out. This is doom and gloom. But you do have to think about how you want to spend those miles or spend the tread on your tires. So over time, as our joints do take on a lot of stress through various activities, the cartilage doesn't necessarily regenerate as fast as it does break down. And as it breaks down over time, that's one of the leading causes of osteoarthritis. Another cause is previous injuries. So maybe you had an old ligament tear, maybe you had an ACL tear, meniscus injury. Those types of situations can increase your risk of developing osteoarthritis down the line, especially if they don't fully heal or there were complications in that recovery. The next is weight. So, although it's only one factor, we do have to consider the impact that weight has on the joints. So, every pound of extra body weight can put as much as 4 pounds of pressure on your knees. And that adds up over time. If you think you're taking 10,000 steps a day, that's just going to compound over time and be a little bit harder on your joints if you do have or are carrying more weight, even if it's good weight, even if it's more muscle. A couple other factors to consider: genetics. So if you do have a family history, that can play a role, a little bit smaller role, but still one to consider nonetheless. And then finally, activity levels. So high impact activities can stress the knee, while lower activity levels can weaken the muscles that protect it. So if you're not active as you age and the muscles around the knee start to weaken, you don't have as much protection against changes in the joint. I always talk about the quad muscle. This big guy on the top of the thigh is the best insurance policy against knee pain. If that muscle's strong, it's going to make up for a lot of irritation to any of those tissues, a lot of breakdown to any of the cartilage around the joint. So the best thing you can do for yourself, especially if you're early on and maybe not having severe pain, is just get those muscles around the knee stronger. It's going to pay off. So next thing to talk about is, what does knee osteoarthritis feel like? So common symptoms that people come to me complaining about will be morning stiffness. The key is that it lasts about 30 minutes. So after you get up, maybe you do a little bit of stretching, get in the shower, it does start to get better, but that first 30 minutes is not super comfortable. Next is pain during activity that improves with rest. So if you're having pain while you're moving around, but it goes away once you stop, Another potential sign of osteoarthritis. Next is swelling or a feeling of warmth in the knee. So if your knees are warm to the touch, that can also point to osteoarthritis potentially. Next, we have grinding or clicking sounds. This might also, you might hear as referred to crepitus. Any popping, clicking, grinding, all of that can help us diagnose as well. And then finally, we have reduced range of motion. So if you have trouble bending or straightening your knee, it can also be a sign of osteoarthritis. So just pay attention, see how many of those boxes you check. And if you are checking many of those boxes, it's possible you could have osteoarthritis. But again, if that is the case, there's so many different grades, so many different levels to it, and it occurs on a spectrum. So it's not immediately, oh my God, I've got bone on bone grinding knee pain, I need to have surgery, because in many cases, surgery is not the only option. But the good news is with knee OA, it does not mean you have to give up the activities you love. There's plenty of different ways to actively manage osteoarthritis and even slow its progression for quite a while. So the first is exercise. So thinking of low impact activities like cycling, swimming, walking, those are all great for keeping the joints moving, but it's also super important that you are still weight bearing. So you can start with what we call low load, high repetition exercises. So doing a little bit lower weight, but doing a lot of repetitions to get that joint moving. Focus on strengthening the muscles around the knees. We talked a little bit about the quads, muscles in the front. We also have the hamstrings in the back, your glutes, your hip muscles. All those help support the knee and reduce stress throughout the joint. So making sure that we're keeping the joint loose, we're keeping things moving. You might have heard the phrase motion is lotion. Well, what that comes from is every time you move the joint back and forth, it helps release synovial fluid, which helps lubricate the joint. And when you have osteoarthritis, the knee joint isn't as lubricated. So it makes sense then when we talk about things like that's really painful for the first 30 minutes, but after that, it gets moving. Well, as we get more fluid through the joint, you're going to be able to move a little bit better as the day goes on. The next piece can be weight management. So even losing 5 to 10% of your body weight can significantly reduce knee pain and improve function. So thinking about different ways that you can stay active and shed just a little bit of that weight, if possible, can be very helpful in reducing the overall stress on your joints. Again, this is only one factor, so I don't want you to hyperfixate on, oh my God, the only reason I have pain is because I'm overweight. It's just one piece of the puzzle and something that you can consider. Next, this is my wheelhouse, physical therapy. So PT can help address muscle imbalances, improve mobility, and teach you strategies to manage pain. So if nothing else, when you do see a PT, you're going to have a lot of different ideas of ways that you can get stronger, more mobile. You'll have a game plan in place in which you know exactly what to do day over day to manage your knee pain and improve your current condition. So highly recommend seeking out physical therapy. And if you're continuing to struggle, feel free to contact me or ask questions. Another piece of the puzzle that's a counterpart to physical therapy is medication and injections. So some people will use NSAIDs on a regular basis, which are anti-inflammatories. The problem with taking the NSAIDs is that if you start to take them and you're taking them for a long period of time, what you're going to notice is your body builds up a tolerance. So what once was a situation that you only needed to take maybe two pills, now those two pills are doing absolutely nothing and you're up to four, and the cycle continues as your body builds up a tolerance. Another common treatment pathway is being recommended cortisone injections to the knee. I think about cortisone injections as like a band-aid. It's not going to take away your pain. It's not permanently, it's not a permanent solution. But what it can do is it can reduce pain, reduce inflammation for a period of time. And during that period of time, it's so important that you take advantage of those decreases in symptoms to get stronger. So maybe it was a situation where you couldn't do some of those quad strengthening exercises because they were too painful prior to the injection. But after you get the injection, you really focus on trying to get stronger. So even when the injection wears off, you still have that strength, and that still leads to improvement in symptoms over time. Other potential forms of treatment using assistive devices. I don't necessarily love this one, but this could be like braces, orthotics, any kind of walking aid. If you're at a point where your knee pain has progressed to where you can't walk normally, then using something like a cane can help offload the joint as you get stronger. I never want those to be permanent things, but if we need them for your safety, then definitely don't hesitate to use them for a short period of time. Lastly, in severe cases of knee OA, surgery may be another option. And this might be something like a total knee replacement or partial knee replacement. And these things can be considered if you're not making the progress you want with physical therapy. But surgery, I always say, should typically be the last resort after exhausting other treatments. A lot of times people will rush to having a knee replacement, but they don't realize that after you do have that surgery, there is going to be a long recovery that involves a lot of physical therapy. It's not going to, in all cases, be immediately provide pain relief. So just recognizing that if you're going to have all this rehab, why not at least give it a try before you do have that surgery? So my approach to treating knee osteoarthritis, my goal is really to help you take an active approach to recovery. So I always focus on trying to calm down the symptoms, address the root cause, why you're having the pain. Is it truly because the joint is wearing down, or is it because some of those muscles are weak or you don't have great mobility? We got to figure out what's leading to that pain. It's not necessarily just that you're aging. Because I think a lot of people will use age as a crutch and just say, well, I'm just getting old. When in reality, maybe their activity levels have changed. Maybe they did have an injury or something like that. It's just considering all factors and then getting to that root cause. But really trying to build strength to keep your knees moving for the long term, because your knees are such a crucial joint. It's so, so important that we can keep them strong so you can do all the things you love for a long period to come. So, knee osteoarthritis, it does not have to hold you back. With the right strategies, you can stay active, you can reduce pain, and really keep doing what you love for a long period of time. If you want to learn more, you can download my free guide to knee pain recovery. Just has different tips on how you can assess your knee pain based on how long it's been going on, where you're having pain, things like that to figure out, is this truly osteoarthritis? Is it something else? And if you have other questions or aren't quite sure about your situation where you're at, just feel free to drop them in the comments. And don't forget to like, subscribe, and share this video with someone who might benefit. Maybe it's a friend, maybe it's a parent who just needs a little bit more encouragement or a little bit more direction with their knee pain as they age. Thanks for watching, and I will see you in the next one.